You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, breast surgery, what you need to know. Hot topic. In fact, we have one of the most popular board-certified plastic surgeons in San Diego on the show today. So if you're not happy with the way your breasts look, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of breast surgery. My first guest has been getting a lot of attention over the years because of the results he gets with his patient, board-certified plastic surgeon in San Diego, Dr. Chasan. Dr. Chasan, welcome to the program.
Well, thanks for having me, Randy.
Now, before we get into today's topic, tell us a little bit about your practice.
Well, my practice is 100% cosmetic surgery.
Okay.
And I would say that it's a higher end practice. I've been doing this for 15 years, and this is, plastic surgery is all about experience. It really is. You can't.
Is that right?
Yeah. When you finish your residency, you're competent, but it takes years to develop the exact sutures you want, the team that you have, training your nurses. It's a team sport.
Now, we invited you on the program to talk about breast surgery, but you do everything. I mean, facelifts, tummy tuck.
I do the full spectrum of cosmetic surgery, and that includes, facelifts, tummy tucks, liposuction, breast surgery, and rhinoplasties. Realistically, in all honesty, people don't realize this, there's only 12 surgeries I do. When you count them all up, that's about what you do. Now, most of us plastic surgeons who do cosmetic surgery do those. But then there's a few things that I do in addition. And we're going to talk about the breast surgery today and the revisionary breast surgery and fixing poor results with breast augmentation, fixing poor results with rhinoplasty. Those are two specialties.
You told me that on a consult, on the phone. I kind of like the feisty part about you talking on the phone, that sometimes you see a consult, and this is a revision, somebody I guess that already had that, and you say, boy, I could have done that better, or that could have been done better.
Yeah, you know what? I'm a craftsman. I'm particular about what I do. Well, I mean, for example, people don't look in surgery in these terms. Okay. But if you go to a home, a beautiful home, okay? You go to a beautiful home and you see this wonderful bullnosing and everything matches. You see great stonework. And you see how the inlaid, how all those stones are inlaid perfectly. I appreciate that, okay? And you know what? That guy who's ever doing that stonemason, that's the guy I want to do my house. And I feel like when I do plastic surgery, that's how I am. Everything has to look good. And when I see other surgeons and I see some work that I say, it's less than that.
Okay.
It bugs me.
You're hard on yourself about this.
I'm my worst critic.
Because you want to be the best.
Absolutely.
You don't mind saying it either.
I don't, because I hold myself to a very high standard.
Okay, now your background, your training, I mean, plastic surgeon, board certified.
Correct.
Did you always know you wanted to be a plastic surgeon?
I didn't. I knew I wanted to be a surgeon. My dad was a family practitioner. I knew I didn't want to do that. I knew from early age I wanted to be a surgeon. And then when you go through your surgery training, you get exposed to lots of different types of surgery. And, like cardiac surgery. When I did cardiac surgery, it was exciting and big cases, and I liked that. And I liked the challenge. But it became very boring. Bypass, bypass, valve, bypass, bypass. And it was the same thing, where in plastic surgery, every nose, every breast, every facelift is different. You're dealing with different tissues. And you can look and say that you get that immediate gratification of seeing an unbelievable job. You say, right on the table, that looks awesome. And that kind of feedback, and each one's different. So every day.
So you love it?
I love it. I never get bored. It's challenging. I love it. And I was a picky kid. And as an adult, I'm lucky that I found a job, a passion that requires you to be picky.
Okay. Now we're talking about being detailed, but with breasts, isn't it for the most part a straightforward surgery? I mean, is there that much to it?
There's a lot more to breast surgery than people realize. Okay. There are no people who are perfectly symmetric. Okay. And that's the problem, is that I see these women who are 40 years old, and I'm examining them and I point out their asymmetries because no one looks at their breasts until after they have breast surgery. And you point out this nipple's higher, this crease is higher, this breast is a little bigger. Your chest wall, your right chest wall is more anterior than your left. Okay. And that's the first time they've noticed that in their entire life. So people don't realize that. And so when I evaluate a breast, it's not the breast I'm evaluating. I'm evaluating nipple height, I'm evaluating size disparities. I'm evaluating chest wall discrepancies, because everybody's got them. Even the most perfect breasts you can imagine aren't perfect.
So your goal is to make them just right or balanced after the surgery.
As perfect as they can within the constraints that we're human.
So what are the different categories of breast surgery patients that you see?
Well, there's really 3 or 4 different categories.
Okay.
The first is just a standard breast augmentation, and that's a pretty wide spectrum, from the young 22 to 26-year-old, never had kids, who just wants to wear a t-shirt without a bra.
Okay.
Wants to wear a cocktail dress and not have to wear.
Is that what they tell you on the consult?
Yeah, they
as
just
far
want
as their
to say,
motivation.
That's a lot of them say, I don't want to be big. I just don't want to have to wear padding. I just want to wear a t-shirt and not have to wake up and wear padding. Or I want to wear a strapless cocktail dress. That's all I want. I want to fill up a bikini. Those are very common statements I hear.
Okay.
The next most common, or just about the same, is the mom. I breastfed my babies for 6 months, a year, and I just want to get back what I had. I mean, after breastfeeding, there's something called post-gestational involution. Okay, what that means is after you breastfeed, the breasts go away, okay? And a lot of these women who had breasts, they've been sucked dry, and they just want to get back what they had. So those are the 2 most common categories. The next most common is those people who've had kids or their breasts have drooped. So now you're looking at either a lift or augmentation with a lift.
Okay.
And then the next category is people with very large breasts and they want a breast reduction. Okay. So those are the biggest 3 categories.
And redos. I mean, you're a big redo guy.
Yes, and that's the next category. It's people who've had a couple either breast surgery done poorly. That's one problem. They can have breast surgery done well and then have a problem. Or they could have had surgery done well and then they had kids, weight gain, who knows, something in their life, and their breasts don't look great.
Are all breasts, by the way, no matter what, I mean, over time and all the working out's not going to help, I mean, they're going to drop. Is that right?
As long as we live on Earth. Now, as soon as we start, living on the moon, then we won't have that. But
it's mainstream. I mean, it's become mainstream. I wanted to ask you, is it the #1 procedure, or is it liposuction still? I mean, what?
It's seasonal, and I would say liposuction is still more common than breast augmentation, but breast augmentation is a close second.
Okay, let's start with the augmentation, and I have questions over the muscle, under the muscle, where you place your incisions, what type of implants you use. So we'll start with.
I'd love to answer all those questions. And over the years of doing, I think I've done about 1,600 breast augmentation procedures. So. You get to know what works, and I consider myself a very pragmatic guy. If it works, I'm going to do it. And I see, and doing revisionary breast surgery, I see all the problems. And so, #1, since the FDA approved the silicone implant for general use in November of 2006, I pretty much exclusively use silicone implants.
So you like the silicone?
Yeah, why?
Why?
Why? Yeah. Okay. Well, the saline implants, with time, almost all of them start to wrinkle. They are much more firm. So when you hug someone with a saline implant, a lot of times they're aware of it. They feel it's firm.
Interesting. Okay.
It doesn't have that
like a water balloon.
Yeah, it doesn't have the soft texture of a silicone implant. The average lifespan of a saline implant somewhere between 8 to 10 to 12 years, where the newer silicone implants are somewhere like 18 to 20 years. And the technology of the silicone implants, the newer generation silicone implants, which have a much thicker wall, they have what we call a cohesive gel matrix. If you cut an implant, a current silicone implant, and you cut it, it doesn't spill out. It's a silicone cohesive gel matrix. So it stays in place. It's like Jell-O. So the old implants, you cut it, it's a sticky, gooey mess of motor oil. So the newer implants, the technology is so much better, and they're very safe.
So is that going on, by the way? A lot of the people that had the other type of implants coming in to get the silicone?
The implants that were placed between the early 70s and the mid to late 80s were of that old style where they've ruptured within 8 to 10 years, and they're a gooey, sticky mess. And I take those out now, and they're obviously very concerned, and there's still like chat rooms based on those old implants, but the new implants have been shown to be safe.
Now the implants themselves, you say, have changed over the years.
They have, and not only has the technology changed, like we mentioned before about the thicker envelope and the cohesive gel matrix, but now there's so many different shapes and styles that I can really tailor a breast to what the patient's desires are. It's not only just size now. You know, a patient can come and say, I want a small C or medium C or large C, and that used to be all we could do. Now I can say, well, do you want a natural appearing breast? Do you want some roundness? Do you want a very round breast? And I can totally control that with
so they're
the
making
shape of
the
implant.
implants different.
Oh, they have different styles. They have a high profile implant, a very high profile.
What does that mean,
a
high
moderate.
profile?
Well, if you take the shape of an implant, you can go all the way from a pancake, a low profile implant. They'll give you a very natural result. There are some limitations with that, all the way up to almost a baseball.
So it just
round.
projects out.
It projects more. It's the diameter's less,
look.
and they give you more roundness at the top.
As far as over the muscle, under the muscle, what do you do?
I go under the muscle about 98% of the time.
Do they still go over the muscle?
Some people do, and I think it's a mistake.
Okay.
Why? The biggest reason to go under the muscle is the degree of capsular contracture or hardening of the implant. It's normal for the implant, your body's interface with the implants to develop a thin layer of scar tissue around it. That's normal.
Okay.
Sometimes that gets hard in about 5% of the cases. And that rate is double on top of the muscle. Also, being a revisionary specialist, I see what these on top of the muscle implants look like 10 and 12 years later, and they kind of slide down the chest wall. And so instead of being here, the implants are now down here, and where they're under the muscle, they don't seem to slide as much, because when you go on top of the muscle, you're disconnecting those attachments to from the muscle to the breast.
Okay, now what about your incisions? I guess you could go under the fold, to the nipple area, armpit, belly button.
Right.
What is your favorite? Do you have a favorite?
When I did the saline implants, I used to like to go through the armpit because I can make an incision this big. But now that I'm using silicone, it's hard to get a silicone implant through the armpit, you know, or you have to make a big incision, which negates the benefit of that. My favorite approach is the periareolar, right under the areola. It heals virtually.
What about incision scars, though?
It heals virtually perfect 100% of the time. I'm not going to say 100%, 99% of the time. I think once every other year I revise
What
a
about
scar.
loss of sensation?
That's real. Loss of sensation occurs. It occurs in somewhere between 5 and 10%.
More so when you go through the nipple than like under the fold or anything
No, that's
else?
a fallacy, actually.
What do you think about the surgeon that tells me, Randy, I don't like to go through the nipple, I like to go underneath because you don't want to touch the most beautiful part of the breast? What do you say to that? I mean, do you go through the nipple because the result is better, or do you do because it's easier to place the implant?
It's actually easier to place an implant in the inframammary crease. However, because I do such a high volume of revisionary and secondary breast surgery, I see that inframammary crease scar. It's very visible. A lot of times it rises up, and most women wish they never had that incision.
Is that right? Okay, well that's good to know.
Yeah, and when you go around the areola, it's hidden. They can wear bathing suits, and it heals so well almost every time. And
so nothing to worry about then?
It isn't, and it's a concern for people, but I can tell you it heals much better than any other scar.
Knowing I was going to interview today, the women were talking, and they were saying, ask you, the second time around, the second surgery, does it, I mean, a lot less pain?
Usually, yes, because the pocket's already developed. So a lot of
times. When you
times,
say the pocket, what do you mean?
Oh, well, where the implant sits, there's a thin layer of scar tissue around. When I take out that implant, I don't have to do anything with the muscles or anything. Everything's already done. So if I have to modify that pocket, the pain is so much less than the original surgery. Okay, lifting. We're going to take a quick break, and I know you have photos, so we'll get to those. But breast lifts. You like breast lifting? I love doing breast lifting. Now, what about the incisions, though? Because you were saying that you don't always have to have that incision underneath the breast in every case. Right. You know what? It depends on the degree of drooping, or what we call ptosis. And a lot of times I can do it just with an incision around the areola, and that's called a circumareolar, or a lollipop. I've virtually eliminated the anchor scar or that horizontal bottom scar from my repertoire. I don't do it. Really? Yeah. Mm-hmm. Really? And that's something that's taken a long time to develop, and we call it circumvertical because you have to put the skin somewhere. Yeah. And so if you can organize it around the areola and work it in, you can just have what we call a lollipop, around the areola and down. And generally those scars heal really well. I would say that's a misconception. Is it? A lot of women have a fear of that scar. And the lift surgery. Yeah, and I would say in most cases, that scar heals really well, and that doesn't bother them at all. Okay, now what about a surgeon that may say, well, most of the time you just put a big implant in there, that creates a natural lift. What are your thoughts on that? Well, common sense. If you're having drooping without an implant, what would happen if you put an implant that weighs a significant amount? It's going to droop more. And I see it all the time. I see, Oh, so you don't think it's a good idea? No, women come to me all the time and I don't want scars. No one comes to me, hey, put scars on my breast. I don't want them. But sometimes they need that to get a great result. And, if they go somewhere and the guy a surgeon talks them into going a larger implant on top of the muscle, invariably I see them 6 months or a year later, and they have a way bigger implant than they ever wanted, and now their breasts are really drooped, and they need a bigger lift than they otherwise would have needed.
What are the age ranges of the patients? Are they getting older and older?
Well, the age range is 18 to 60s.
60?
I'm seeing a lot of people in their 50s and 60s. They want to look good. Here in Southern California, everybody stays in shape and they look good, and I see a lot of women in their 50s and 60s still in great shape and care about their figures and how they look, and they're having breast surgery.
All right, now we're going to take a quick break. We come back. I want you to take me through the process. How you determine size, and how you make symmetry, and questions about cleavage as well, how you're able to do that, and we'll get to those photos. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're here with one of the most popular plastic surgeons here in San Diego County, Dr. Chasan. We'll be right back. You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of breast surgery. With us we have board-certified plastic surgeon, Dr. Paul Chasan. Okay, if somebody's watching this, they're not happy with their breast, what can they expect? I mean, what happens on day one, and specifically, how do you determine size?
Okay, well,
Does that come up a lot, by the way?
That's crucial to what we do. I first want to hear their story. And listening is the most important thing.
Really? Okay.
Yeah, because there's categories. Small c. I don't want people to know I've had a breast augmentation. I just want to be big enough.
They say that, okay.
All the time. I just don't want to wear padding and those kinds of things. Or I just want to be proportionate. Or I want large breasts. You can categorize somewhat just by listening. And then I've developed a computer program that has dozens of pictures, and I can click, and it's a very visual sport.
Of real patients?
Of real patients.
Okay.
It doesn't have their face. And they can look at, a lot of women are sophisticated, and they can look at those pictures and say, too big, too small, too round, not round enough. And so it's kind of like going to the optometrist, click, 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 you know how they do that?
Yeah.
So we do that process. And so after listening to their story and then going through the process, we virtually nail it 100% of the time.
Do they try something on?
No, you know what? I think it's inaccurate. People try bags of peas or implants, and a size of an implant outside the body in a bra is totally different than what it is inside. And sometimes I think some surgeons take away their own responsibility by saying, well, you pick the size. To me, I feel like this is my 1600 experience.
Okay.
This is the patient's first experience. I'll take the responsibility. You communicate, we'll communicate on what you want to do, and I'll create that in the OR. Remember, in the OR, I have you laying down, I look at sizers. I have 100 so implants in my office. I put a sizer in, I lay you down, I see how it looks laying down. I sit you up, I see how it looks.
You say you set people up to 4 times.
Absolutely, I'm a perfectionist.
To make it look right.
It's crucial. I mean, that's how they look when.
But that's not common, you say.
A lot of guys don't do it. I don't know why. To me, it's crucial to what I do.
But do women come in and say, and this is what other surgeons tell me, I want 250 or 300 cc's?
Right. You know what? It's very difficult because this happens very commonly. A woman comes in, she's referred by her friend had 300 cc's, and I want to look like my friend. But remember, the end ultimate shape of the breast, the end result of the breast, is their anatomy, their breast tissue, plus the implant.
Okay.
So, you take 300 cc's on one person who has no breast tissue, and you put that same implant in somebody who has a fair amount of breast tissue, their end result's going to be different. So that's where my expertise comes in, because I have to look at their, like I said, chest wall asymmetries, how much breast tissue they have. If somebody shows me a breast that they like, I can duplicate that. And I do that by using sizers and my knowledge and experience on the table. So if they tell me they want 300 cc's, I'll ask them to show me a picture of what they like too.
Is it more art than science, or 50-50, 60-40? Because going into this,
I think it's art and craft. The science of it.
To make them look beautiful, like you say.
Yeah, you have to have an artistic vision. You have to have a vision of what you want, and then you have to have a particularness to want to make them right and symmetric, and go through all those details of breast size, breast shape, asymmetry, chest wall asymmetry.
So how does a woman pick, and we're just about out of time and I want to get to those photos, how does somebody pick a breast surgeon?
Well, I think the one good way to do it is ask the anesthesiologist.
They know. Okay.
They see all the breast surgeons, so they get to do that.
You do other doctors' wives.
I do other doctors' wives. In fact,
even plastic surgeons go to you.
In the last couple of years, I've operated on 4 plastic surgeons in the area.
Okay, your photos, what are we looking at there?
Okay, well, the biggest misconception about breast surgery, you asked that before, is that I do big breasts. And see, that's the problem, is women see one big breast, or a big round fake breast, and they notice that, and they think, oh, plastic surgeon, he did that big round fake breast. When actually, in reality, the vast majority of the breasts are small C's, natural, but you don't notice those. Those are the ones you don't notice.
Interesting, okay.
So that's the biggest misconception. And so, for example, like this is a typical patient that I do. She's 26 years old, she has an A-cup breast, she just wanted some more fullness, she didn't want to be big, she just wanted to...
Very natural, by the way.
Yeah, and you see you can't tell there's an implant. Yes, I do fake ones, but that's the minority. The majority are natural ones.
Okay.
So that's a picture of that. Here's another one, and this one, she has breastfed, she has 2 children, she has lost all her breast volume. She also had a little extra areolar tissue outside her normal areola, which I incorporated into the incision. Okay. You can see the incisions are well healed. You can't even see them. And you see that she had a fair amount of asymmetry.
You can't see the incisions. Very nice.
And it filled, she just lost volume. And you can see it on this view here. She just lost volume and she just wanted to get back.
So she's happier now.
What
you
she
say they
had
wear bathing
before.
suits, dresses now.
Absolutely. And then, some people want, this is a medium C. These are small C's. This is a medium C. And this is, she wanted a little fuller breast. She wanted to be more proportionate to her body. And she wanted a little bit fullness on the top. So that person had that. And these are the kinds of things, by using different style implants and then communicating with the patient, we can achieve whatever result they really want. And you can see in her, pretty typical here, no tan. Afterwards, she has a tan line. We see that all the time, because now they're excited about wearing bikinis. And you know what? I can't tell you how many times after doing breast surgery, it's changed their life.
Do they bring in a partner, by the way, with them on the consult? Is that
a lot
common?
of times they bring husbands and boyfriends, and sometimes some of these women, they get so much more confident that the bad boyfriend, they get rid of him.
Is that right?
I love to see that.
Okay.
But
do you like when they bring in
I love it. Yeah, because the more you can communicate, and a lot of times it's a communication between all parties. But the ultimate decision's in the person wearing the implants, and that's the woman.
All right. Okay. So we have time for probably 2 more, and that's what you have, right?
Well, yeah, I have a couple more, and some people need lifts. They just do, and putting an implant just won't do them justice. And this is a particular case where I was able to do the lift just through incision around the areola.
So what was going on before? This
is after having children.
Is this common, by the way?
And this is called a tubular breast, they are very common. And it's a little bit of droop and a big areola. And a lot of times I can do these tubular breasts.
So you reshape the nipple
breast
area.
Yeah, and you see how her breasts are kind of triangular, and so I use the implant to shape her breast and give her a rounder appearance. And look at her cleavage zone. Before, no cleavage. And this is something that women really want. They want cleavage. And you can look at her, look how her body looks completely different. And in this particular case, I mean, she's so much more confident about everything about her life. I mean,
like in the side view,
it's amazing how a lot of women will just dress differently after having breast surgery. There's more proportion, they feel sexier, they feel more confident. And you know what, I see it. I see them light up, and that's really great for me.
Okay, okay.
And this is the last one I'll show you is, this is what we call a lollipop lift. And if they have a little more droop.
Why is it called a lollipop?
Because it looks like a lollipop around the areola and down.
Oh, this is the incision you're
incision.
So this is a lift patient.
Right. And so she didn't want to be big. She wanted to be somewhere between a small and medium C, very natural. And you can see those incisions just aren't that visible. And
so this is what they're worried about?
That's what they're worried about.
Because I've seen pictures where it is a huge, we've call them T-scars, things like that.
Yeah, well, I've eliminated the T-scar.
You've eliminated the T-scar.
Yeah, and the...
What does that mean, by the way, you've developed a procedure to
would
lessen
say
that?
The circumvertical lift has been around for a few years, and not many surgeons were trained in it, and it's something that's been a personal quest of mine, and I think not many surgeons in the area...
You feel like you mastered it?
Yeah, absolutely.
So you're the lift guy in San Diego,
I would say so.
Say that.
I
really?
would confidently say that.
Okay. So this right here, this is really nothing to be afraid of, and you call it a lollipop scar?
A lollipop scar. Mm-hmm.
And downtime for these? They're out of work a couple of days, 5 days?
The lift adds 0 to the downtime.
Okay.
So it's the same as a breast augmentation. Most people feel good at 3 or 4 days. I tell people they can be back at work at 5 days.
5 days. Some people probably go to work anyway, whether you tell them
that's
a couple
true.
of days. There's nothing. We do have one more. Time for one more.
Okay, well, this is just another example of a circumareolar. That's just around the areolar type lift and an implant. And you can see this, again, look at her cleavage zone. Again, significant improvement. Then look at her side view. See how she's deflated above her areola? And now you see how the fullness, how much her breasts look, and look at how just better proportion she is.
So this was a lift and?
A lift and an
And
implant.
what signifies a lift? I mean, what distinguishes a lift?
Elevating the breast or elevating
But
the
where
areola.
are you pulling it up? I mean, where are you hiding the incision, I guess, is
The
my
incision's
question.
around the areola here. It goes all the way around the areola.
And you could create a lift that way?
Correct.
Okay. And do you think that's a misconception with women that don't want to get a lift because of this big, ugly scar?
Yeah, because, again, if you see one bad, ugly scar, you're freaked out about it. Same thing with facelift. I see one bad facelift,
right,
and it negates 100 great ones.
Interesting.
That's it. And these scars, I would say the vast majority of them, they heal great.
So
and
it's
the
not
patients are
something
happy.
they complain about.
No, it really isn't.
Their incision.
No, they really
don't. So if somebody's thinking about a lift, don't be afraid of the incision.
Don't be afraid with the right surgeon.
All right. Well, we're out of time. I want to thank you so much for coming on the show. All of these photos are on your website.
Yes.
All right, and you still meet one-on-one with your patients?
Absolutely.
All right, okay. Well, thanks.
Randy,
thanks
thank you very much. It was a pleasure.
All right. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online or direct a friend to it, you can visit our website at wellnesshour.com. You'll probably have this on your website as well.
Absolutely.
Okay. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.